Hey guys, good afternoon. It's Dan Lannon, just saying hello. It's our usual Tuesday town hall forum, and just wanted to welcome you all. I apologize for being a couple minutes late. We were working out some details um, behind the scenes, but I hope everyone is doing well as can be, is safe, and happy Cinco de Mayo to everyone, May 5th. And so Sharon, again, will be joining me in a little while, and we'll sort of have the same format. We'll probably wrap up under an hour, but I guess a good amount of things to get to. Really, a lot of information still the same, but still a good amount of things to get to. So we still have the currently still there is no one at our COVID center, New Boston Street location, which is great news. We've been able to get that cleaned. Last week you saw the pictures of that Dan showed, and we've been able to replenish some supplies there and PPE equipment, and thankfully no one is there occupying that space right now. We do have the one house where we had the 4 people test positive in one of our locations, and Dan mentioned that last week, and they're still at that location, and they are coming up. We should have them sort of cleared at any point, and we're happy to say those women are doing fine, and everyone's been healthy, and that has gone very well. And so that is great news. Great news. We're still waiting on results for somewhere between 5 and 10 individuals. Sharon probably will correct my numbers, but that's where we're at. As far as individuals that we've tested, is waiting on results for them. And staff members, again, I'll leave that up to Sharon. As far as staff that have tested positive, we are sort of cycling through different staff coming back off of their quarantine period, and new staff going on it. And so we're very thankful to, again, all those staff who have been willing to put themselves make themselves available to cover shifts that they don't normally cover, or just work overtime, or do, go above and beyond. And there has been a number of those staff that continue to do that. And, and I know there's other staffs that have limitations to what they're able to do. And certainly we understand that with their own child care and family life and everything. But again, our staff have been incredible during this, and we're so thankful for everything that they've done and continue to do, and for the staff that have volunteered at the center, as well as working at the regular residential homes with non-positive cases of COVID. It's a challenging time for that, as well, as because we are all stuck at home, but it is good weather finally, so at least some good weather, so we can get outside, get some fresh air, be a little more active, and I think that certainly helps the day. Well, certainly I know that helps the day. And so yesterday we had a testing site in Westford. Sharon's going to do some updates on the testing site in Westford and tell you about our pop-up site that we hosted, and how we approached that, and sort of some specifics about that. As far as the rest of the houses and residential programs, the same families that took individuals home before this crisis all started still have those individuals at home. We've tried to keep in touch with them. People report, same as everyone else, just a little stir crazy at home, some good days and some bad days, but we have heard, and we continue to hear very positive feedback with the virtual learning and the virtual care that is happening during the day. So I want to thank all those staff that have helped out in planning that and coordinating that. It's amazing to see, and if you had to have a chance to check it out, please do so, because the morning meeting, to the lunchtime hang, to the gross motor skills, the activities, exercise classes, all of it has been phenomenal to come together that quick, and we've heard such positive feedback from family members, from individuals, and as well as funding source. So and on a state level, I guess I'll talk about it, where things are at on a state level. We did have a couple of calls this morning with our Kelly Lawless, the regional director for the Northeast region, and we also had our ADDP forum call this morning. And Kelly reported that they found themselves in the Northeast region with the highest amount of cases for individuals that we serve and in the Northeast region that she felt that they were in the biggest surge that they've had thus far. She reported a number of agencies struggling with losses of individuals that live within their programs. And we certainly talked about that in past weeks of those ones that we've lost, whether living with us. Thank God no one living with us, but people that we've served in our programs for a number of years. And so, I know, so many people, all the conversation is about, getting back to normal and trying to get back to, keeping social distancing, but trying to get back to some semblance of our days. And I know that people are struggling with this. There's various opinions and everything, but I do think that from what we know to be true, which is some of the precautions we've taken, which were hard precautions to take, but the early decision to not allow people to come and go into the residential programs, to make sure we put the health checks in place, the temperature screening, to make sure we had ample masks available, all of those things to limit visitation of families, which I know has been a struggle for many of you all, and it would be for myself as well. We know those weren't decisions accepted with great open arms, I guess you would say, but please know that those decisions are made, and every decision we're trying to make is in the best interest, of the men and women that you guys allow us to serve every day. And so we will continue to do that, no matter how unpopular some of those decisions are. But hearing that we're in a region of care for DDS where they're in the middle of their search, I don't think this is a time to jump the gun too quickly. I do think that there is a group of us meeting about what it will look like maybe when we start to open up a little bit and transition out, and so we will certainly keep you posted on that. I'll have some more news on that next Tuesday, but we definitely want to make you aware of not only what's happening with NuPath as a whole, but also the region, because I think many of our individuals that we serve, the 300 plus, not all live with our residential component. Over 2/3 don't, and so we know that they're at residential programs, and we know they're on these webinars, and their families are on these webinars, and we sympathize with the losses that they're experiencing for individuals that might not even come to our programs. And we certainly don't want to put anyone in jeopardy by doing it too soon for the individuals we serve. So I'll chime in like I usually do after Sharon does some updates. But that's really the main thing going on. We will continue to monitor things, to continue to have the center ready on the go in case we do need to move in more individuals into that location. We have had a number of houses recently get tested, and so we're sort of where we've been throughout this whole thing, which is the peaks and the surges that we've seen. We've been able to manage relatively seamlessly, and that's thanks to the residential team, Doreen and Michelle, everyone that's really helped out. And so we will continue to just make sure we are ready at the go if necessary, and we're anxious to get the one house that people are positive cleared to go back to sort of some not a quarantine center, and be able to get back to some semblance of their lives. So Greg, if you want to go ahead and bring Sharon in, that'd be great.
Hi, everybody. I'm not sure if you can see me, but that's okay with me. Can you hear me?
Yeah, no, we haven't been able to see you yet, though, Sharon. We can hear you.
Okay. All right, but you can hear me. Okay.
Yes.
Okay, good. All right. So I'll just on a couple of updates. Nursing continues to check in with all of our group homes twice daily. That's been going really well. We tested 3 houses recently. One of them we had to really call everywhere to try to get results on that. That's probably the biggest frustration on the mobile testing is trying to get the results. And so you have to almost assume that people are negative if you don't hear back from them in a timely fashion. They're saying it's anywhere from 1 to 3 days, can be up to 5 days. If you're positive, the call goes right to the Board of Health, and the Board of Health will contact the person or the guardian on someone that was positive. But otherwise, it's you're waiting to hear back. Over the past few weeks, we've had about 6 staff that have been positive and gone into their own quarantine. A couple of them are ready to actually come out soon. Yesterday, we, like Dan talked about the mobile testing site, we collaborated with DDS and Fallon Health, and we did a pop-up testing site out in our Westford location, which we tested about 60 people yesterday, which was really good. There was good positive feedback. They actually do the nasal swab. They go up into your both nares, so they're putting it up one and then out and up the other one to get a good collection of the just to make sure that they get a good specimen. And they said that the people should hear between 1 and 3 days from that. They did add an app to it now, so people can log into an app, and then they'll be able to get their results that way. So that's hopefully gonna speed the process of people getting their results. I will I know Dan mentioned earlier, but we did lose over the weekend another one of our longtime attendings, Donna Parker, passed away. She did have the COVID, and she was transferred to, there's Donna. She was, her sisters were able to have her transferred to a hospice house, and they were able to actually be with her so that they could be by her side as she peacefully passed away. Many of Donna came to NuPath for a very, very long time. And she was really a hoot to know. We really did love her. And it's sad that she's passed on as well.
Yeah, I know.
I'll hold that off for my last thing to talk about.
Sharon, thank you for updating us on Donna, and I know Dan will talk a little more on Donna on Thursday. Donna has been with NuPath over 25 years, and certainly during the time that you and I have been here, and which is 20 plus years, she had some health issues over those years, but she was always healthy and always so fun loving to be around, and had so many friends, and she will be missed. She was a good friend. So Donna spent some time really at each one of our programs, certainly the vocational program at first, and in the Martin Center, as well as Westford. And so she has touched the lives of many staff and everyone here, and she would be sorely missed. And thank you for updating us on that. As Sharon mentioned, we did the mobile testing site yesterday in Westford. That was put on by Fallon Health in coordination with DDS. And so they've hosted a number of these in the region, and they've made them available to exclusively staff, although we were able to have one of the residential home and the staff at that residential home tested at the time. And so we do have a number of individuals that are out there having been tested that we're waiting on. And so we try to stay prepared and stay ready, and just make sure that we have all the supplies we need. As far as some people reaching out over the weekend, or questions coming in over the weekend, and you know, I know a number of families have started to visit and drop things off a little bit more, and I know that has been happening throughout this whole time. And Dan talked about some of the donations that have come in to help really the houses and to help all of us through this time. And so I just want to, you know, personally say thank you to all them, because everyone's just been so good and so supportive, and even in times when we're disagreeing about maybe whether we should be in lockdown or coming out of lockdown or transitioning back into you know, some semblance of socialization. I think we really have to factor in, you know, not how I treat things myself, but certainly how I would treat, you know, the health and safety of every person that we serve. And so so thank you for those families that we've had some healthy discussions back and forth about. But that's where, you know, we will continue to try to make those decisions, not based on one isolated case at a time, but as a whole for all the men and women and that we serve. So that's about it from me. I don't have really any great additional updates. You know, we still are waiting for some of the DDS money that we've been assured that would help us through this time, and Dan's talked about that and kept you up to the financial situations. And so I won't go into that too in depth. But you know, I would just reach out to staff and say to staff that are on this, that if they're not able to get their full allotment of hours, to reach out to Elder, Doreen and Michelle, and certainly pick up some shifts. And you know, I've said across the board many times to many people I've had conversations with, you know, every day of the week is the same now. It's not, there's Monday through Friday is the same as Saturday and Sunday. And so every day is the same for all of us. There's not more things open on a Monday. Excuse me, there's not more things open on a Monday that wouldn't be open on the weekend, those type of things. And so please try to be as flexible as you can and help cover these shifts. And for all those staff that have been as flexible and been willing to step up and cover shifts that are not, you know, what their familiarity or expertise might be, we're so appreciative of that and so thankful. And to everyone, you know, behind the scenes, the financial people, the admin people, everyone sort of working with the remote learning and remote health, and the nurses with the check-ins, everyone's done so much and gone above and beyond. And you know, we are probably 4 to 6 weeks into this, depends what date you want to use and what time frame. And we know that Governor Baker's guidance was to the 18th for the stay-at-home ordinance, and then we know right after that it won't be, you know, business as usual. And so we hope to be able to lay out what that means for NuPath and for what our plan is going forward soon. But again, we don't want to rush. We don't want to rush that decision. So, Greg, I don't know if there's any questions. If you see any questions out there for me, I don't see any on this end.
No questions, but I think just bringing Sharon back in. Sharon has something to add.
Okay, great. Yeah, Sharon, I couldn't see you on video, so I didn't know if you were completely done or just needed.
I tried to look good today too. Anyways, I just wanted to add that tomorrow's National Nurses Day, May 6th. So I just want to give a shout out to our nurses. There'll be Stephanie Fitzgerald, Rexanne Royal, Jen Cuniff, Jen Zanetti, Kathy Ahern, Coralie Beckingham, Kelly Laif, Melissa Ahern, and Mara Griskovich. So thank you.
Oh, Sharon, thank you. And include your own name in that shout out, because you know we would certainly be lost without the guidance you and your team have provided through this time. And so thank you for reminding us of that, and that is great news. And so certainly comes at a you know, there couldn't be a time that everyone's a little more appreciative of everything that nurses do, right? Not only for NuPath here, but at hospitals and taking care of our families and loved ones when needed in those hospital settings and stuff. And so so yes, thank you to all the nurses and to everyone, and celebrate on May 6th, Sharon, do you have any special like parade planned or anything in specific that people should know about?
For tomorrow?
Yeah,
No.
no. All right, well,
No. But,
email Greg if anyone has a great suggestion of something that we should think about to do for the nurses tomorrow. Maybe you can email Greg and
Okay.
he can help us work on it.
I just want to add a lot of comments coming in, thanking you, Sharon, and all the nurses. In considering I'm married to a nurse and I had no idea that tomorrow was National Nurses Day, I'm going to throw you a parade myself. So thank you for that.
That's good.
Yeah, and I guess I know we're going to talk about it more later in the week, but we also know that this Sunday is coming up as Mother's Day too, and
Yep.
and so certainly, to my mother and to all mothers out there and all the mothers I've talked with during this time frame and just worked with over the years, let me wish you a happy Mother's Day. In case I'm not back later this week, but I know Dan has a few things planned for that.
I'm terrible. I forgot Luann. Luann dead from what? See, that's why you should never name names. Oh, that's terrible.
All
Sorry
right.
for interrupting you.
So if there's no other questions, if there's no other thoughts anyone has, that's great. Again, if you have them and it comes up after you leave the session here, certainly certainly reach out to Greg or to Dan and we'll make sure to include those on Thursday's meeting, as well as Friday's Unity celebration. I know he has a special Unity celebration planned for Friday. And I wanted to thank Sharon for coming in, doing those updates and for letting us know about Donna and having a minute to think about all those years of her brightening our lives. So thank you all very much. Greg, if there's nothing else, I guess we could sign off a little bit early, just about 3:30.
Thanks, Dan. That's it.
All right. Thank you, everyone. Take care. We'll talk to you soon.